Prashanta Kumar Roy, born and brought up in Calcutta. So one day I got that opportunity to attend the Manipal Hospitals outdoor clinic, OPD clinic in West Bengal, where I met orthopedic doctor Mr. Kumardev. I consulted with him about regarding my knee problem, and also explained to him that at this age of my 77 plus, everybody is telling that don't go to the operation, major operation, because it will not be successful. But after discussion with the doctor, Mr. Kumardev, I got the confidence, and then I decided to come in Bangalore in Manipal Hospital Whitefield.
Manipal Hospital Whitefield conducts outreach orthopedic OPDs in West Bengal once a month. During one of these OPD clinics, we met Mr. Roy, aged 77 years. He consulted us for severe pain around his knees. He had swelling, severe pain, and a deformity around his knee which hampered his activities of daily living. He found it extremely challenging to sit, to stand from a sitting posture, to walk, and to use his stairs. On clinical and radiological examination, he had swelling, he had a bow leg deformity, what we call as a varus deformity, he had restriction of movements, and grade 4 osteoarthritis. Now, the only appropriate viable medical treatment at this stage is a total knee replacement.
So in the last year, I took the challenge and came here in Manipal Hospital in Bangalore, Whitefield, take the major operation over there. And it is a so good operation taken by the hospital and other amenities. The operation, within the 15 days, I got some good result. I was in 15 days in Manipal and Bangalore, and I got all the facilities over the hospital, and I recovered nicely, and now I am very fine.
In a total knee replacement surgery, we replace the damaged portion of the cartilage and its underlying bone with artificial metal aided by specialized instruments and place a high density, highly cross-linked plastic in between them. Now by doing so, we achieve painless mobility and perfect alignment and deformity correction. Presently, Mr. Roy is able to walk a good distance without any pain, and he is able to carry out his all routine daily activities comfortably, and he is not dependent on painkillers anymore. No wonder a total knee replacement surgery successfully done is considered as one of the most rewarding procedures in orthopedics.
The operation also over last 1 year, 2 months, and I am walking and living my normal life. So it was a challenge that Mr. Kumardev, I talked with him, and he assured me there will be no problem. Naturally, on that point of view, I contacted with him in Bangalore and came to Bangalore in the last year, and with the challenge I do my operation.
We at Manipal Hospital Whitefield are able to provide comprehensive care and perform complex orthopedic procedures efficiently and successfully. With the support of highly skilled team of anesthetists, intensivists, cardiologists, pulmonologists, physical and rehabilitation department with extremely well-trained OT personnel and world-class OT infrastructure. There is nothing more gratifying than helping an individual regain his normal function to a great extent.
I could not expect that I will come back to the normal position. I took that view that something will happen. Before my surgery, I could not walk properly, could not walk. In any job, I took the help of other friends. Now I am free, I am doing everything my own self, so I am very fine living at this stage of 78, like a young man.